glaucoma specialist diagnoses glaucoma in a patient, then obviously treatment has to commence. The treatment is aimed at lowering the intraocular pressure such that further damage to the optic nerve does not happen and the visual field defects are preserved so that blindness is avoided. Sometimes we can detect glaucoma at a very early stage, even before field defects have happened, by looking at subtle changes in the optic nerve, which is identified with the help of advanced optic nerve scans. The optic nerve scans are even done by scan machines which are with the high street optometrists, and they are called optical coherent tomography scans, OCT scans. So when you have an examination at the high street optometrists, from the glaucoma perspective, the optician can check your pressure within the eye, which is called the intraocular pressure. They can do the visual field examination to identify or look for any defects, and they can also look at the optic nerve by doing what is called OCT scans of the optic nerve. If there is any suspicion within the findings that there is a suspicion of glaucoma, then the patient is referred to the hospital specialist and will be eventually seen by the glaucoma specialist. It is the job of the glaucoma specialist to then identify if there is glaucoma or if there isn't. When the diagnosis is made, then the glaucoma specialist looks at a number of factors to decide the best treatment. It depends on the stage of glaucoma, whether it is at a very early stage or whether there is already a lot of damage and the glaucoma is advanced. It also considers various other factors like the type of glaucoma, the age of the patient, because obviously the younger the patient, there is a greater importance to arrest the disease so that the vision is preserved for the rest of the lifetime. When all these factors are considered, the consultant will make a choice of treatment, which can be either medical treatment or with lasers or with surgery. Obviously, when the disease is very early, then treatment is easy enough, and the easiest way to start treatment is by prescribing eye drops. These eye drops are drugs which penetrate the eye when they're instilled in the eye, and they work to reduce the pressure by a number of ways. Nowadays, there is a very new treatment, even at the start when glaucoma is very early, and that is by laser, what is called selective laser trabeculoplasty. I have been doing selective laser trabeculoplasty, or SLT as it is called in brief, for a number of years, and it is done at the Midland Eye Care in Burton-upon-Trent.